With everything going on around the world, you may have missed a lot of the updates around COVID. Notably that from the 24th of February, even people who test positive for COVID are no longer bound by law to self-isolate. This is because all of the remaining restrictions have been lifted. And so whilst adults and children who have the virus are advised to self-isolate, it's no longer a legal requirement. Equally, those who are vaccinated who've been around someone who's tested positive are no longer being asked to do daily tests for the 7 days as they once were. And all contact tracing in that regard has come to an end. Not only that, you're no doubt aware that mask requirements have also been dropped, including in schools, although Transport for London has kept this rule, as I understand it, on their services. But this also comes about around a time when the efficacy, that is the effectiveness of the Pfizer vaccines, is coming to question with younger people. Specifically, a New York State research study shows that during this recent Omicron surge, the efficacy against this infection with 5 to 11-year-olds who received Pfizer fell 56% from 68 to just 12%, whilst those aged between 12 and 17 the efficacy only fell by 15%. It should be said, however, that some medical professionals have questioned just how robust this finding is to really say that the vaccine's effectiveness has reduced by so much. Pediatric Dr. Offit said that the goal of the vaccine is to protect against severe illness and to keep children out of hospital, adding that it's not surprising that the effectiveness has reduced with the Omicron variant, which is, as he says, somewhat immune evasive for protection against mild illness. This news coming about just shortly after the government announced a plan that all children aged 5 to 11 will be offered a coronavirus vaccine in England and Northern Ireland as part of these new plans. So as I said previously, I think it's going to be a long time before proper studies are done and to determine what the long-term effects are of all of these vaccines and to what extent each variant is going to evade them. But in the meantime, as the government puts it, the plan is just to learn to live with it. And I do wonder how many people have already had it without knowing that they've had it. At the very start of the pandemic, I remember having a very high fever just one night and then it disappeared. And I've had nothing since, and I've certainly been out and about among lots of different people, and I know of lots of children who have been in and out of lots of different schools, clearly mixing in very large groups and not suffered whatsoever. So as always, time will tell, so thank you for watching. Please give the video a thumbs up and subscribe, and I'll see you next time.